Today's LGBTQ+ youth come out at younger ages and are met with a major increase in public support, yet they are continuously at high risk for compromised mental health. LGBTQ+ youth have higher rates of poor mental health compared to their cisgender heterosexual peers. So what are mental health disorders and its risk factors? Mental health disorders refer to a wide range of mental health conditions or disorders that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, eating disorders, and addictive behaviors. Some of the risk factors of mental health disorders include suicidal attempts, sense of isolation, impulsive and aggressive tendencies, and hopelessness. Mental health disorders in LGBTQ+ youth are not caused by them being LGBTQ+, but stem from exposure to rejection, bullying, discrimination, violence, or little to no family support. There are about 1,994,000 young people in the U.S. who identify as LGBTQ+. According to the 2023 U.S. National Survey on the Mental Health of LGBTQ Young People, done by the Turalba Project, 41% of LGBTQ young people seriously considered attempting suicide in the past year. 56% of LGBTQ young people who wanted mental health care in the past year were not able to get it. Fewer than 40% of LGBTQ young people found their home to be LGBTQ affirming. A majority of LGBTQ young people reported being verbally harassed at school because people thought they were LGBTQ. Nearly 1 in 3 LGBTQ young people said their mental health was poor most of the time or always due to anti-LGBTQ policies and legislation. Sexual and gender minority youth were more than 3 times as likely to express symptoms of depression and more than twice as likely to have self-harm than their heterosexual peers. Most of the LGBTQ+ youth who reported poor mental health were victims of marginalization, isolation, rejection, and phobic behavior. These actions not only caused the fear of coming out amongst the LGBTQ+ youth community, but was also responsible for the suicide of young males aged 13 to 19 years old. LGBTQ+ youth experiencing homelessness faced even worse forms of discrimination, such as being robbed and beaten up in their sleep. They would also face vocalized prejudice and judgments by law enforcement, leading them to either avoid highly police-populated areas as much as possible. There is also a lack of LGBTQ+ youth mental health care knowledge among healthcare providers. Some community assets for the LGBTQ+ youth community will be raising awareness surrounding inclusive education that acknowledges LGBTQ+ identities and histories. Helping the youth find support within their families and peers will also help them become confident in their own skin. Representation in media can also help LGBTQ+ youth feel included and have someone to look up to. The majority of LGBTQ+ youth prioritize the importance of positive representation of and connecting with LGBTQ+ groups on social media. They felt supported through content from people who shared experiences. Key forms of support included social media content and news that portray LGBTQ persons positively in reliable ways. Peer-driven interventions have proven to be effective in increasing awareness and reducing incidents of cyberbullying among students. Those who were exposed to the Theory of Reasoned Action (TRA) program showed increase in knowledge of cyberbullying and empathy towards victims immediately after the intervention. School-based interventions to effectively improve mental health outcomes include a whole school approach, intersectionality, collaborative leadership, school culture, and the legal, political, economic, and discursive environment. With isolation, discrimination, marginalization, and victimization being main factors of poor mental health among LGBTQ+ youth, it's important to help them feel included. Raising awareness on LGBTQ+ youth mental health not only increases accessibility of mental health care services for the young people, but also shows that they matter. LGBTQ+ youth are people too, and they deserve the same respect as everyone else.